Greetings from Buddhi Clinic. Alzheimer's disease, the commonest of many types of dementia, is a global health challenge affecting over 50 million people worldwide. Shockingly, every 3 seconds, someone is diagnosed with Alzheimer's, highlighting the urgency for effective solutions. As this number continues to rise, the demand for cutting edge treatments, innovative technologies, and holistic care approaches has never been more critical. There are deposits of amyloid and tau proteins forming tangles and plaques in the nerve cells and damaging them, causing impairment in memory, behaviors, and difficulty in doing their activities of daily living. Today, we are here to explore the many facets of Alzheimer's disease, from its cognitive and neurological impacts to the latest breakthroughs in treatment and care. We will delve into the role of technology in diagnosis and management, lifestyle interventions that can slow its progression, and emerging therapeutic strategies that offer hope for patients and caregivers alike. Joining us today are 5 esteemed specialists, each bringing a wealth of knowledge from different fields. Together, they will guide us through this complex but crucial discussion, offering insights into how we can better understand, treat, and support those living with Alzheimer's. Anandi, having seen a lot of elderly patients with cognitive impairment, so what are the early signs and symptoms that the family should look out for?
The most common symptoms that is associated generally with Alzheimer's are memory issues, forgetfulness, all that. But what early signs they should be catching for are very subtle signs like, problems in judgments, making bad decisions frequently or wrong decisions frequently, the patient suddenly getting withdrawn and showing very poor initiative and being quieter sometimes, wanting to be by themselves, avoiding issues, or probably some of them very mild symptoms like, losing orientation. They generally lose track of dates or locations suddenly. These are the subtle signs which start at a very early stage. Also, research says that, subtle or complex brain changes happen almost a decade before signs of decline start.
Is it also common for Alzheimer's patients to have problems with mood and behaviors other than the memory issues that they have?
Yes, definitely. Processing subtle emotions become a problem when they develop mild cognitive decline. Hence, leading to a lot of behavioral changes and also emotional dysregulations. They are unable to probably have a control over their emotions. Some of them develop or display behaviors like irritability and impatience, all those things. Definitely, emotional dysregulation does happen.
What cognitive rehabilitation therapies are commonly used and are effective in patients with Alzheimer's dementia?
Most commonly used or followed cognitive rehabilitation therapies are something which we call CRT, cognitive restructuring or cognitive retraining, however we do it depending on the deficits of the patient. So there, interestingly, there's something what we call reminiscence therapy, where we kind of take the patient through, many events about the past. We show them photographs, we show them people from their past or any details about their past, and we help them recall and reminisce about those events, which are a way of actually trying to help them recall their memory. So these are the things, some of the things which we follow.
The caregivers that we get to meet when they come with the patients, they have a lot of distress, as we know. So, how do you help them cope with managing these symptoms?
It's a very important component of our therapy or treatment because we give so much of importance to the caregiver burden and the stress which the caregiver goes through because of taking care of the patient with a cognitive decline. So we take them through a very systematic caregiver counseling sessions where we psychoeducate them, where we help them deal with their own stressors, because many times it can be very frustrating or it can be very disappointing, and it can be very burdensome for a caregiver to deal with a person who has issues with their memory, who are forgetful, because Many times the patient may not be able to even emotionally relate to what this person is saying or doing for them, which can lead to a lot of emotional stress. So learning to deal and cope with their emotional stress is very, very important for them to pay more attention to the caregiving to the patient. So in order to have a very healthy caregiving process, the caregiver needs to be addressed also and needs to be helped out to deal with their own problems.
Vivek, what are some of the latest advancements in treatments in the field of neurotechnology?
So, in the current scenario, apart from the monoclonal antibodies, which delays the progression of the disorder, the use of non-invasive brain stimulation methods are getting a new traction. One of the modality, which is the transcranial magnetic stimulation, is being found to be effective to reverse the progression while stimulating the precuneus area of the brain. Similarly, the use of transcranial direct current stimulation when adjunct with normobaric oxygen therapy have found to be beneficial in the memory aspects of the Alzheimer dementia. Apart from the memory, these modalities can be used in the behavioral symptoms of Alzheimer's and other forms of dementia.
Is there any computer based testing to predict the onset of Alzheimer's symptoms?
So, when we talk about Alzheimer's and other dementias, there are several cognitive domains which get affected, such as simple attention, complex attention, memory, cognitive flexibility, etc. To measure these symptoms, we use a test called CNS vital signs. This test can be done in person at the clinic or remotely via computer based system. The test can be administered multiple times over 6 months to track the progression of the symptoms, as well as it indicates at what pace there are symptoms are getting better also with the help of the interventions the patient is going through.
Vivek, what are some of the challenges that you face in integrating technology into routine Alzheimer's care, and how do you help patients to overcome them?
One of the challenge which is faced by the healthcare system across the globe is adherence to the treatment protocols. Usually, when the patient with Alzheimer's dementia is not cooperative in visiting the clinic or a center, the schedule adherence become a major issues. To overcome these challenges, we can employ the home-based therapy, which also include the non-invasive brain stimulation methods such as TDCS. TDCS, being a very small device, can go to the patient home or a caregiver facility, which can be delivered at the bedside. When we talk about the schedule adherence, the enhanced schedule adherence also shows its promises in delaying the disorder, also looking at the quality of life which can be improved with the right help at the right time.
How can these treatments be personalized using technology?
Imaging modalities like PET-PIP give us a very clear picture of the brain damage happened due to Alzheimer's dementia, but unfortunately they are not available in India. Alternatively, we can use the psychometric profile and QEEG guided neurofeedback to know the brainwave pattern. These input help us personalize the treatment plan for each patient. For example, the use of TDCS in stimulating the prefrontal cortex when there is a behavioral issues. We can stimulate the temporal lobe when there is a memory issues. Similarly, the CRT techniques based on these interventions can be employed in adjunct with the range of holistic care. Bringing these solutions together is what the future in Alzheimer's care and providing the personalized care to each patient.
Dr. Vishnupriya, can you tell us how nutrition and lifestyle play a role in managing Alzheimer's?
Nutrition and lifestyle can significantly influence cognitive functions and brain health. Food rich in antioxidant and omega 3 fatty acid will reduce the degenerative changes and improve overall brain health.
As a holistic physician, what therapies would you recommend from the Ayush basket of therapies for patients with Alzheimer's dementia?
There are few combinations of therapies like acupuncture, aromatherapy, massage therapy, yoga, and meditation. These gentle physical activities combine movement with mindfulness, improve balance, flexibility, and relaxation. It will enhance mood and reduce anxiety by promoting blood flow and reducing the stress levels.
There are lifestyle changes that help a patient with Alzheimer's dementia. So, how would you advise the caregiver to incorporate these into the daily schedule?
For caregivers, ensure the patient receives the proper nutrition without overwhelming the caregiver. Incorporating daily exercises through simple activities like short walks or stretches can be effective. Encouraging social interactions through family visits or group activities stimulates the brain. Additionally, activities like board games, reading, or art can be included to keep the mind active. Setting a regular bedtime, minimizing noise, and ensure the bedroom is dark and comfortable can improve sleep quality. Mindfulness or meditation exercises to reduce stress for both themselves and the patient.
Yuvraj, how does Alzheimer's affect a patient's physical health? And what role does physical therapy play for such a patient?
As there is cognitive decline, the patients with Alzheimer's disease will be forgetting all the movements and activities in their daily routine. So they have to do certain activities regularly. It will improve their daily routine and also their quality of life. But with these patients, all this will be getting confused and patients will not know how to do and what to do. So what happens is the caretakers also will feel very difficult in handling them. So this is where the physical therapy comes into the role, as the physical therapist will be engaging them in certain activities and various activities which builds their muscle strength and also improve their range of motion and also improve their daily activities. So daily activities in the sense we have like fine motor activities like writing and brushing and other sort of things, and also we have the gross motor skills like walking and sitting and doing jogging certain times. So all these things will be affected. So the physical therapist will be training the patients with their exercises and also with their modalities like pain relieving modalities, and also they will improve their muscle quality and movement through their manual therapy and also through active exercises, free exercises, and other exercises. So with the type of various sorts of exercises and various sort of activities, the physical therapy will help a lot in the Alzheimer's disease. The patient will be very independent and also very functional.
Can physiotherapy prevent such patients from becoming bedbound?
Obviously, because the physical therapy will help in a lot of patients who have difficulty in their movements. So their mobility will be getting affected in those patients. So we should concentrate on their mobility. Before going into mobility, we have to concentrate on the muscles. So as the muscles which does not move and which is immobilized, it may tends to go for the muscle spasm. Muscle spasm is nothing but it is a sort of muscle tightness. Because we are not moving the muscles, muscle will go into tightness. So to relieve those muscle tightness, initially the best thing is to do some manual therapy for the muscles and to relieve the stiffness of the muscles, and also the exercises will maintain the muscles movements actually. So the mobility will be maintained through the exercises. Exercises, we have various kinds of exercises like active exercises, free exercises, resisted exercises, and all the types of exercises. So if you are asking the patient to do the exercises directly, they will not do. So it should be in a playful manner. So it will be very helpful for the patient to engage in the activities, and also the patient will be doing the uh, therapies and do the exercises through the playful activity. So this will make the patient to be independent and also be active and also be mobilized.
We see many patients with Alzheimer's dementia having Parkinson's and musculoskeletal dysfunction. So, Yuvraj, from the Advanced Neuro Rehabilitation Gym, what solutions do you have to offer for these problems?
Mostly Alzheimer's patients will be having other comorbidities like Parkinson's and musculoskeletal disorders. So these musculoskeletal disorders and Parkinson's are like mostly make the patients very dependent because of the immobility and also because of the muscle stiffness and pain and etc. In order to relieve all those symptoms, so we have in our advanced rehab gym a functional magnetic stimulation. It is also called as peripheral magnetic stimulation, where we treat the muscles with the magnetic stimulation. So what will happen is the electrodes will be placed on the muscle. So the muscles will be having the electromagnetic induction. Inside the muscle, the electromagnetic induction will be happening, and it will increase the blood circulation, and also it will improve the muscles working, and also it will relieve all the stiffness of the muscles. So this will make the movement very easy, and it will make the patient to walk and do the movements better. So again, the muscle spasm will be relieved by muscle stimulation, and also we have a various protocols in our FMS, functional magnetic stimulation. These protocols are like to relieve the pain. For we have a protocol, and also we have a protocol for training, muscle training. So if a muscle is very weak, we tone up the muscle, and also it helps in increasing the power. So because of increasing the power, the muscle movement will be better than the before. So this will facilitate the movements, and also it will facilitate the activities of daily life in the patient, and also it will improve the tone of the muscle, where they will improve, it will improve their balance, equilibrium, and also it will improve their gait. That is,
Can the one-on-one treatments that we often do for our patients, can those be translated to group therapy as well?
yes, of course, because social activity and also the physical exercises have a great role in these patients. So when we talk about the group therapy has a great role in this, because the patients who are sitting around will be having the feedback from the other patients. So this will make them to just do the activity without any interruptions. The interest will be increased in them, and also the more of repeats, that is the repetitions of the movements will be increased because of the visual activity, and because of the improved interest, they'll be doing the activity properly without any interruptions. And also, because the patients are all alone at home, so what happens is they will not do any activity, they'll be very idle. So when we come to the center and they participate in these group activities, what will happen is they are very enthusiastic. We are seeing that patients are very enthusiastic, and they are involving the movements and the activities regularly, and they are not missing the classes also when it comes to the group therapy. So the patients, what they will do is they are very helpful to the with the other patients also. So if the one patient is not able to do certain activity, the other patient, even with their disability, they are able to help those patients either with the physical help or with the verbal prompts. So these are the helps, and these are the improvements we are seeing through the group therapy. And also lots of fine motor skills also have will is improved through these exercises. That is the two group activity, because we'll give them certain activities like painting and certain activities like writing. Those are the skills we'll train them through the group activity. This will be like a competitions. So they are very like a kids, they participate in these kinds of group activities, and they show their own interest in order to bring their results. Apart from this fine motor skills, and also we work on the balance in the sense we'll be asking the patients to stand all around, and we'll be in the circle, and we'll be giving a ball. This is for example. So what will happen is we'll ask the patients to pass on the ball. So as they are passing the ball, we'll be concentrating on the various movements like hand activities, their concentration, their social activity, and also the standing balance. Everything will be improved. So this is a kind of neurodevelopmental therapy, I can say, because in neurodevelopmental therapy, what we will do is we will be concentrating on the all the other activities, not on a single activity. So through one activity, all the domains will be concentrated, so that they'll be gaining a lot of confidence, and also they'll be gaining a lot of muscle strength, balance, and gait training and everything. So this is the usage and benefit of the group therapy.
Bhargavi, at what stage of Alzheimer's disease do communication issues start coming in for Alzheimer's patients?
Communication difficulties are majorly noticed in middle and late stages. In early stage, minimal word finding difficulties are seen. But in middle stages, we could find severe word finding difficulties. Following and involving in a conversation will be much more difficult. Whereas in late stage, they primarily rely only on gestures and pointing, and following a simple commands will also be very difficult. And these symptoms might vary from person to person. Not everyone who follow these stages won't have the same symptoms.
Will speech therapy focus only on verbal communication for such patients?
Not always, because speech therapy we usually focus on both verbal and non-verbal communication. And as we know, Alzheimer's is a degenerative condition involving or focusing only on a verbal communication won't be an effective one. So introducing and enhancing both verbal and non-verbal communication from the early stage will be effective even when they transit to the later stages as well. So not always a verbal communication will be reinforced. Both verbal and non-verbal always will be focused.
How prevalent are swallowing problems in patients with Alzheimer's?
Swallowing problems are very prevalent in Alzheimer's, and even it is not noticed much. In recent researches, we could find that around 84% person who fall into middle and late stages usually experience swallowing issues or dysphagia. So the frequent signs what they exhibit are fast eating. They eat very fast, which results in choking as well, and coughing while eating, dehydration. Because of their cognitive issues, dehydration will be the predominant factor where they forgot to drink water. So these are the major signs, and because of the cognitive disturbances, these swallowing issues are more prevalent in them. And in few cases, who have more of comorbid conditions also have the muscle weakness, which also plays a contributing factor towards this swallowing issues.
So, what role do the caregivers play in reinforcing communication?
So communication breakdown is an important thing which is usually seen between the patient and the caregiver. Communication breakdown is seen because of the communication deficit in this patient. They have a reduced vocabulary, following conversation is affected, and understanding the non-verbal cues of the caregivers is also affected. So to enhance it, we have to focus more on the time aspects and then the language aspects. In time aspects, we need to give more time to the patient so that they can process whatever the information we speak, and then give more of gestural cues so then they can identify what is the non-verbal thing we are trying to convey. And then instead of asking more questions, we can give them the simple descriptions, or use of specific style of conversation will be helping more, and this will promote an effective communication.
As we have learned from our experts today, Alzheimer's is a complex condition that requires a holistic and multifaceted approach. Cognitive therapies, technological innovations, lifestyle modifications, physical therapy, and speech interventions all play crucial roles in enhancing the quality of life for patients and their caregivers. The future of Alzheimer's care lies in continued advancements in both medicine and technology, alongside a strong emphasis on personalized, comprehensive care strategies. At Buddhi, we are committed to staying at the forefront of these innovations, integrating cutting-edge treatments with holistic approaches to deliver the best outcome for our patients. Stay tuned to this space as we continue to share our unique approach to managing Alzheimer's and leading the way in compassionate, forward-thinking care.